Hi, Dr. Pitz here for another Dentapreg tip. Today I will talk about how to choose useful accessories for composite restorations. Whenever we start a procedure, we have to have thought it out in advance, and we need the proper materials that will allow us to save time, be very predictable, and allow for comfort, both for the patient and the doctor. For restorative dentistry such as composite restorations, it is most desirable to use a dam in order not to compromise the adhesion. We have to understand that the weakest part of the acid-etch composite procedure is the bonding strength of the composite to the tooth structure. Prior to the introduction of the polymer dam materials, the rubber materials were weak, ripped upon placing, and were too thin to keep the saliva and blood from contaminating the restoration. With the introduction of the polymer materials, the technique has become very easy. If you've thrown the technique into the drawer, I recommend using it on all restorations, as you will find it to be one of the most important aspects in placing composite restorations. If we are making lab fabricated inlays, onlays, crowns, bridges, or provisional restorations, I highly recommend using clear plastic trays with no holes. These trays have superior qualities that have been unseen by most dentists. There are several reasons why we should be using them. These trays are easy to use, cheap, and clear so you can see where you are placing it when you try it in. If you have patients with loose teeth or big spaces between their teeth, any attempt to get a tray with holes and hard impression material out of the mouth can result in tooth damage.